Good day everyone, we are the group 2.
So for today, we'll be performing a return demonstration of patient positioning. So patient positioning is used for physical assessment and for comfort and safety of the patient. It is also to ensure the patient's breathing and circulation throughout the assessment.
Next is oral hygiene. Oral hygiene is a part of basic nursing care. It can be defined as the promotion of health and the prevention or treatment of disease of oral mucosa, lips, teeth, and the gums.
Hi ma'am, good morning. I am Riza and I will be your student nurse for today. So ma'am, for verification po, may I see your wristband? Please state your complete name, please.
Ana Francia Capullo,
And your birthday,
July 25, 2005.
and your age. So thank you very much po. How would you like me to call you ma'am?
Hannah,
So ma'am Hannah, how are you? So for today po, I am going to assist you in patient positioning. Meaning to say, ma'am, you have to do some position that is important for physical assessment and also for your comfort and safety. With that, ma'am, I'll be needing your 100% cooperation. Is that okay with you?
Yes.
Okay, before we start, ma'am, you have any questions? Okay. Next is close the window and the door to provide privacy. After that, ma'am, just relax, make yourself comfortable. And then next, I'll perform hand hygiene to prevent cross-contamination. So the first position that I will be doing is the supine position. So to do that, I'll now assist my patient to lie on his back. And then I'll put the pillow under my patient's head. And of course, I'll assist her. And now, I'll put the blanket for my patient's comfort. So my patient is already in the supine position. This position is used on general physical exam, male catheterization, and other operative procedures. So the next one is the prone position. To do that, I'll now assist my patient to lie on his back. And then I'll put now the pillow under my patient's head. And then I'll ask my patient to turn over. And of course, I'll assist her. And then I'll put pillow under my patient's head. And of course, in her lower extremities. Then I'll ask my patient to put her hands over. So that's all for the prone position. So this is used for back examination and massage as well as in the relaxation of the hips. Next, ma, we'll be doing the 3 variations of Fowler's position or semi-settling position. So the first one is the low Fowler's position. So to do that, I'll assist my patient to lie on his back. So we don't have any adjustable beds. We will just use a pillow as an alternative. So my patient is already in the low Fowler's position. The next one is the semi-Fowler's position. So I'll just put pillow over here. So my patient is already in the semi-Fowler's position. It should be 30 to 45 degrees. The next one is the high Fowler's position. It is nearly vertical. So again, we don't have any adjustable bed. We will just use pillow as an alternative. So my patient is already in the high Fowler's position. The 3 variations of Fowler's position are used for a patient who have difficulty breathing. It also helps to facilitate drainage after surgery. Next is the dorsal recumbent position. To do that, I'll just separate your legs like this. And then I'll just put a blanket for my patient's comfort. So my patient is already in the dorsal recumbent position. this position is used for vaginal and pelvic examination. So the next one, ma'am, is dorsal lithotomy position. To do that, I'll assist you to lie on your back. And then I'll just put your feet over here. So we don't have any adjustable bed. Therefore, we'll just use a chair as an alternative. And then just put blanket to my patient's for her comfort. So this is the dorsal lithotomy position. So this position is used for cytoscopic examination, examination also for vagina, cervix, as well as the bladder. Now, ma'am, I'll be doing the lateral position. To do that, I'll assist you to move on your right side. And then I'll just put a pillow over here. Like this. So my patient is already in the lateral position. So this position is used for the examination of rectum as well as inserting of suppositor. The next one, ma'am, is a Sims position. To do that, I'll ask you all to turn over, moving your right side, and of course I'll assist you. And then I'll just place pillow over here and in your lower extremities. So the patient is already in the Sims position. This position is used for the examination of rectum and of course insertion of the renal cavity. And lastly, we have the Trendelenburg position. To do that, I'll just the bed like this. So my patient is already in the Trendelenburg position. Hypotensive patient can benefit from this position because it promotes venous return. So ma'am, that's all po for the patient positioning. Thank you so much for your cooperation. So next, I'll perform hand hygiene to prevent cross-contamination. And then I'll document everything that I got.
Good day, ma'am. I am Nurse Hannah and I will be your nurse from 7 a.m. to 7 p.m. So for verification, may I ask your name?
My name is Ashley.
Your birth date?
August 25, 2004.
Your age?
9 years old.
Can I check your ID band? I'll be checking the chart. Okay. So ma'am, I'll be performing oral hygiene. Meaning, itutoothbrush ko po yung teeth nyo. Is that okay with you, ma'am?
Yes.
So I'll be touching some part of your head, especially the mouth. Do you understand, ma'am?
Yes.
So I'll be providing privacy.
Position the patient at 90-degree angle. This position makes it easier to clean all parts of the mouth and helps the patient rinse and spit properly. Additionally, it allows you to see the mouth better, keeping them safe and comfortable.
So I'll already gather all the materials. Then I'll be performing hand hygiene. Next, I'll be putting some Colgate, not the size. I'll be putting the drape on your chest.
Cover the patient's chest with a towel or drape to keep their clothing clean. Place your toothbrush at 45-degree angle and begin to brush the patient's teeth. I use a front-to-back motion to clean the outside surfaces of the teeth, starting with the left and right lower quadrants. Then, move to the left and right upper quadrants. Next, brush gently in a circular motion in the middle of the teeth. And lastly, brush the chewing and inner parts of the teeth. After brushing each quadrant of the teeth, assist the patient in rinsing their mouth. Wipe the patient's mouth with the towel on their chest. Since we don't have dental floss, I use a toothpick to floss between the teeth. I'll assist the patient in rinsing their mouth again. Then lastly, I'll offer her mouthwash.
So now I'll be removing the drape. Of the materials I use. So now, ma'am, I'll be positioning you in your comfortable position. So relax, ma'am. And that's all for oral hygiene, ma'am. Thank you for your cooperation. And lastly, I'll be documenting the patient's completion of test. Thank you so much. Bed shampooing, a procedure that contains washing or cleansing a patient's hair. It helps to promote good hygiene, comfort, relaxation, and stimulating blood circulation in the scalp by removing dandruff and excess oil. It also aids to assess the condition of patient's hair, skin, and scalp. Good morning po. My name is Ashley and I will be your student nurse po for today. So can I please check your wristband po? And can you please state your name, age,
19.
and birthday?
21, 2005.
Okay, thank you po. So for the day po, we'll be doing shampooing in bed. But for me to be able to do that po, I will be needing to touch your head po. So do I have the permission po?
Yes.
Okay, thank you po. So you'll be in a supine position po to keep you comfortable. And we'll provide privacy po by closing the door. We will do the hand hygiene po. I'll wear my gloves. So before we proceed to washing your hair, I will need to check your hair and scalp po for any signs of dandruff and skin breakdown. So your hair and scalp po is clear of any dandruff and skin breakdown. Then put down your blanket po. And I'll be putting a towel po on your chest to prevent you getting wet by the...
Remove the pillow and put a waterproof pad and a towel.
I'll be taking towel.
Place the pillow under the patient's head so when the patient lies, the head is tilted backwards.
And we'll place cotton balls in your ears. And I'll place a towel in your forehead to prevent the water from getting in your eyes. So, we proceed na po with the procedure. So, first po, I will be wetting your hair.
Then we'll put shampoo in both.
Repeats the washing and the rinsing 2 to 3 times as necessary.
So after shampooing and rinsing your hair po, we're going to dry your hair.
Then, after drying the patient's hair, dries the patient's forehead and ears. Then, remove the cotton from the ears.
So we'll just comb your hair and remove any tangled hair. So after combing your hair po, we're going to remove the towel. And we'll put back your pillow with a towel underneath. Now, let me just remove the towel on your chest and put the blanket on. And let me just remove my gloves. Next po, I'll do hand hygiene. So that's all po for shampooing. Thank you so much po for your cooperation. Next po is documentation. Documentation the completion of tasks and note any changes in the patient's hair and scalp.
Transferring of patient. Transferring is the use of proper body mechanics in repositioning, lifting, and transferring patients safely. The purpose is to position and to prepare the client for a variety of clinical procedures. The first step is to take the client's chart and verify the doctor's order. Also verify the client's diagnosis and restrictions. Integrate on the assessment the level of comfort and their muscle strength. Perform medical hand washing to reduce the transmission of microorganisms. Prepare the materials needed for the procedure. Then, check the equipment's condition. Introduce yourself and identify the client. Then explain the procedure to be done. Lower the bed to its lowest position and raise the head of the bed if not contraindicated. Instruct and prepare to assist the patient. Place one arm under the client's leg and the other at the back. Carefully pivot the client. The legs must be dangling over the edge of the bed for at least 2 to 5 minutes. Place the wheelchair at a 45-degree angle on the strong side of the patient. Lock the wheelchair brakes and elevate the foot pedals. Put the transfer belt and secure the client. Reminders for lifters. The knee should be well flexed with back straight, hands on each side of the belt. Lift the client on the count of 3 and keep the knee slightly flexed. Pivot turn with the client with their back facing towards the wheelchair, keeping a firm grip on the belt with flexed hips and knees while lowering the client. Assess the client for proper alignment and sitting position. Secure the safety belt and place the client's feet on foot pedals. Return the materials and hand wash. Document the procedure done. In transferring the patient from bed to stretcher, follow the procedure and position the patient in a supine position. Roll the draw sheet on both sides and put the stretcher beside the patient's bed, 1 inch lower than the height of the bed. Make sure to utilize teamwork to maintain the patient's level of comfort. Return the materials and hand wash. Document the procedure done.
Next, back massage provides comfort and relaxes the client, and it facilitates the physical stimulation to the skin and the emotional relaxation. Before the procedure of back massage, kindly approach the patient safely. Confirm their identity. Explain the procedure while obtaining oral consent. Provide privacy to the patient. Tire the patient comfort by adjusting the air conditioning and bed to their liking. And remember to truly wash your hands beforehand. Applying oil to the patient back reduces friction, enhancing comfort during the massage experience. Stroking is a type of massage consisting of long, slow, gliding stroke. This rub has relieving and sedative effect. Friction. It is performed with the help of the thumb and finger pads. It also helps in reducing swelling after nerve inflammation. Tapotement. This involved hacking, tapping, beating, and clapping. Tapotement helps in atrophied condition of the muscle. It increases the blood supply and the strengthened muscle. Lastly, kneading. Kneading is a part of the Swedish massage tradition and involves the grasping and lifting of the tissue. It is usually performed with the palms first pressing down on the muscular tissue. Remove the oil from the patient back. Help them dress in a comfortable clothes. Ensure that they are in comfortable position. Evaluate the patient experience. Shut down all the equipment used. And lastly, wash your hands.
So now we are doing the procedure of bathing of clients. Bathing of clients is an essential component of nursing care. The nurse retains the responsibility for assuring that the hygienic needs of the patients are met. The two general categories of bath are cleansing and therapeutic.
Today, we will be demonstrating bed bath. So before providing bed bath to the patient, first thing we need to do is to identify first the name, birthday, and the status of the patient. Next one, we need to ensure the privacy of the patient to provide comfort. We also need to offer bedpan or urinal prior to bathing. So before providing bed bath to the patient, make sure to perform first the proper way of medical hand washing. It is to reduce the transmission of microorganisms. Loosen top sheet and replaces it with bath blanket. Bath blanket provides warmth and privacy. Removing of top lines prevent it from becoming soiled during the bath. Remove client's clothing under the bath blanket and then remove pillows by bath blanket under the client's head and place towel over the chest to make it easier to wash ears and neck. Towel prevents soiling of bed linen and blanket. Wet the washcloth and fold around in the hand in a neat and fashion. Neat retains water and heat prevents splashing. Wash and dry the eyes from the inner canthus to the outer canthus using separate corner of the washcloth. To prevent transmission of microorganisms, using circular strokes, wash the face using soap with client's permission. Rinse, then pat dry. It facilitates through cleansing soap, tends to dry face. Then clean the area behind and round ears and neck. Soap rinse at least twice and pat dry. Remove bath blanket from arm farthest from you. Place towel lengthwise under arm. Wash with soap and water using long firm strokes from distal top proximal. It stimulates circulation and promotes venous return. Movement of arm mixerces axilla and exercises joints normal room, rise, and support arm above head while truly washing axilla. Excess moisture causes skin maceration or softening. Then rinse and pat dry. Repeat the procedure on the near arm. Immerse both hands in water for 3 to 5 minutes. Soak and wash hands with cloth. Paying attention to the interdigital spaces soaking softens cuticles and cellulose of hands, loosen debris beneath the nail and enhances feelings of cleanliness. Rinse hands and remove the basin, then pat dry hands with towel. Then repeat the procedure in the other hand. Check the temperature of the water. Replaces if necessary. As warm water maintains client's comfort, place bath towel across the chest and abdomen. The spraying prevents unnecessary exposure of body part. Soap rings and dry chest, paying attention to the area of the umbilicus and under the breast secretions and dirt. Collect easily in areas of tight skin, folds, Bath abdomen, paying attention to the umbilicus, abdominal fold strokes from side to sides. Wash, rinse, and dry. Well moisture and sediment that collect in skin folds predispose skin to maceration and irritation. Cover chest and abdomen exposed near leg by folding blankets towards the midline. It prevents unnecessary exposure. Flex the legs at the knees and shape other leg. And in genital area with blanket. Wash the leg from distal to proximal end. Using long film stroke, paying attention to popliteal area. Rinse but enjoy. Place basin lean with towel on bed. Raise lower leg and slide basin under lifted foot and then soak well. Soap and wash, making sure to bat between toes and then rinse and dry. While proper positioning of foot prevents pressure being applied from edge of the basin against cough secretion and moisture may be present between toes. And then repeat the procedure in the other leg. Assist the patient in side lying position. Place the towel along lengthwise along the side. Wash, rinse, and dry back from neck to buttocks. Using a long film stroke, pay special attention to folds of buttocks and anus. Give back rough and change bath weather. Skin folds near buttocks and anus may contain fecal secretion that harbor microorganisms. And then change. And then wear disposable gloves if necessary. Gloves prevent contact with microorganisms in the body secretion. And then assist in supine position. Cover upper areas of the body, exposing only perineum. If the client can wash, cover with blanket. If not, wash, rinse, and dry the perineum. Pay special attention to skin folds, especially client performing partial bath prefer to wash their own genitalia. Dispose gloves properly and then assist the patient in dressing. And then comb the clients. It promotes client's body image. Then assist the patient to a comfortable position. Clean and replace bathing equipments and then wash hands. It reduces transmission of microorganisms. That would be all. Thank you.